Community Health Center Employee category. This individual is a Health Center employee from Asian Health Services in Oakland, California. Sherry Hirota, CEO of Asian Health Services, is here to present the award.
Good evening. It's my pleasure on behalf of Asian Health Services, its staff and its board, as well as the board and organization of AAPCHO, to recognize Christina Ng, Dr. Christina Ng. Can you come up? You bring her daughter. Wonderful. We're so glad, and actually I'd like to use this opportunity to have all the staff and board members of Asian Health Services and former staff and board members of Asian Health Services stand to be part of recognizing our extended family that we've come together in Washington, D.C. to celebrate Christina's award. I think it's just really fitting that AAPCHO has organized this essay that, after all, what we do in our health centers is not only provide services, but to be a voice for our community, so that healthcare policy and the priorities of our nation's resources are really directed to make our communities more healthy. So with that, I'd like to bring Christina up and have her say a few words. And her daughter.
Thank you, Sherry. I'm so excited to be in Washington, D.C. We've been trying to squeeze in as many museums as possible. It's hard with the 3-hour time change from California and the daylight savings time. But I wanted to say that growing up in San Francisco, I was a typical ABC, American-born Chinese, who didn't know very much about China, except that that the communists are bad, that my grandfather was publicly flogged, and my grandmother was paraded through the streets humiliated because they owned land they were landowners back in 1949. And I only spoke broken Toisanese, so I didn't know very much about my own culture. The only thing I knew about other Asian cultures was what I saw in the Olympics. But since I've been at Asian Health Services and they offer interpretation in 9 different Asian languages, I've come to appreciate the diversity and richness of many other cultures, and after 10 years I've learned to speak Cantonese. Working as a family physician, I have learned, my patients have taught me that healing can occur even when the patient's physical complaints don't improve at all. Many people feel better when you merely allow them to tell you how much they're suffering. In many cases, people have left professional careers in their countries only to come to America to work 2 or 3 minimum wage jobs doing menial labor because they don't speak English. Nevertheless, despite all the stress and anxiety, when I asked them if they would have come if they had known how hard they would be working here, they all invariably respond with a resounding yes, because they want their children to have a better life. They don't mind sacrificing their own happiness in order to have hope for the success of the future generations. Yet, as this new generation of ABCs and other Asian and Pacific Islander Americans emerges, I see that it is much harder for them to connect with their roots because they have not lived in their homeland or experienced the starvation or witnessed the bombings to truly understand what it was like growing up there. Consequently, I'm very thankful that AAPCHO has come up with this idea of an essay contest and the formation of a story bank, because we need to record and document as many of these stories as possible in order that the future generations can appreciate the blood, sweat, and tears their predecessors have shed in order to earn them the privileges they now enjoy today. So I encourage every one of you to just write down one story that you know of, because that simple act will multiply the story bank manyfold and give a voice to those who have none, so that their stories and efforts do not go forgotten. So remember, write down your stories and go and get your mouth swabbed to become part of America. 5 years ago, my brother donated his bone marrow and to a 55-year-old woman who had leukemia. And just recently, she came and found him and wanted to thank him because in those 5 years, she was able to see her daughter graduate from college and see another daughter get married. So you can also save someone's life. Thank you.
Oh!